Good afternoon and welcome to Live Healthy Miami Gardens Facebook Live weekly health and wellness series brought to you by the City of Miami Gardens, Live Healthy Miami Gardens. Our goal is to bring our community information and resources to help us make the healthiest choices possible for ourselves as a Miami Gardens community as well as our families. My name is KeTia Harris. I'm Community Health Data Specialist at JTCHS Community Health System, Program Manager of our Breastfeeding Touchpoint Program based out of JTCHS Miami Gardens, member of Live Healthy Miami Gardens, and your host for today. Live Healthy Miami Gardens was born from the realization that although health is largely influenced by our individual choices, the conditions in the communities where we live, learn, work, worship, and play are also major contributing factors to the racial and ethnic health disparities and health care disparities faced, as well as our overall ability to make healthier choices. We know that these conditions are systemic, historical, and continue to impact us as communities of color and a whole here and now. So Live Healthy Miami Gardens is a community initiative and part of the city's efforts to address these conditions and reduce poor health outcomes through the transformation of policy, our environment, and the healthcare system overall, making the City of Miami Gardens a healthier place to be. Joining us today is Esther McCann, doula for mommy, advocate for baby, helper of family, and founder and CEO of Metro Mommy Agency. She also serves as education and communications coordinator for one of our community partners, the Jasmine Project, co-chair for the Healthy Baby Task Force, is one of 21 partners along with Live Healthy Miami Gardens and Jesse Trice and WIC Miami-Dade, making up the Breastfeed Miami Collaborative, and co-collaborator with Rose, who reaching our sister everywhere on a new initiative to ensure that mothers of color have access to breastfeeding support and other resources in our community. Esther, thank you so much for joining us today, especially at the time that I did call you. A blessing always to have you join us. Can you tell us a little bit more about yourself and Metro Mommy Agency?
Hi, everyone. Thank you so much for having me. It's always a joy to be here. I'm the owner of Metro Mommy Agency, a company that I started back in 2015. And I have been serving moms as a mom myself of 4 boys, as a birth doula, a postpartum doula, a certified lactation counselor, and also a hypnobirthing childbirth educator. And so my company is all about addressing these disparities through encouraging families, giving them education so that they can have a much more healthier pregnancy, a better birth outcome, and also a better postpartum period when it comes to the breastfeeding. So that's what I do.
Nice. Are these services free, or how do we go about accessing these services through Metro Mommy?
Okay, so definitely all a family needs to do is just reach out to me, go to my website, fill out a form so that we can get connected on a free 30-minute consultation. And after that time, I can determine, what it is exactly you need. And so depending on a family's budget, their time constraints, their insurance coverage, there's different ways that you can access it. So some people pay out of pocket. Some people are able to get Medicaid to pay for the services because I am a part of the National Doula Network. And so right now I'm taking on some plans, not every single one, but hopefully that'll change soon. And then if they are a Black mama, I actually partner with Southern Birth Justice Network to provide up to $500 towards my fee or my rate to help support any family who would like to, book me as a doula. But then through this program that we're going to talk about today, I've also partnered with Southern Birth Justice to provide the breastfeeding support for free. So if you are interested in taking a breastfeeding class or being a part of our support groups, all of those services are 100% free, whether you are a Southern Birth Justice Network client or not. This is open to the entire community.
Thanks. And let's get into that. Can you tell us a little bit more about your collaboration with Southern Birth Justice as well as Rose?
Absolutely. So my partner in this wonderful effort is Whitney Hester, and she had a relationship with Rose because she became what they call a community transformer. And so recently, during a visit there, we learned about some funding that was available and thought about bringing it back here to Miami, which has always been a dream of hers. And so I'm very grateful and thankful to Dr. Bug and this opportunity to, along with a lot of different people all over the country, which is really awesome, right? There's families all over our country who need breastfeeding support. And so their dollars don't just stay in Georgia. Their dollars now are stretching out throughout the country. And I'm so grateful to be a part of, those dollars reaching here in Miami-Dade County. And so that's how that collaboration started. And as far as Southern Birth Justice, I have been working with Jamara Amani, who has been an amazing midwife to work with, Black midwife here. Very passionate about serving majority Black clients in her practice as a midwife. And I just felt the need to make sure that as she's referring out to me, these moms who need lactation support, that I can do a little bit more. And so through the program, what's happening is they are expanding my ability, my capacity to provide breastfeeding support. So now we have an entire platform dedicated to helping those moms stay connected and stay abreast on what's going on. We also now have funding towards a platform that will help us kind of see what's happening prenatally. Okay, so I'm also a doula. It's hard for me to take that hat off. And so when I see a mom who's breastfeeding, I have no choice but to ask her, how was her birth? And if she is not breastfeeding yet and she's pregnant and she's getting into my breastfeeding class, I have to ask about that, because what's happening prenatally definitely can impact what's going to happen in the postpartum period, especially when it comes to breastfeeding. So we've gotten funding for that, and we have freebies, we have giveaways, we have, so much stuff that we can start to disseminate to our community. And I'm very happy about that.
Thanks. And I wanted to ask about that. So the services that you're offering through this grant versus the services you offer through Metro Miami Agency, does that allow you to overlap those services, or do you keep these services separate? Or
absolutely, it's in alignment. So all of my current breastfeeding moms, they have access to come right into the program, whether it's the support groups, or if they wanted to take a class, they will not have to pay a dime. And if they also need access to family resources, which is something I'm very passionate about. If a family has some needs, whether it's baby items or things like a cell phone, internet, this is something that can be funded through the program. So I'm very happy about that part. And that is something that I got a taste of, because the Southern Birth Justice does something very similar. They provide a stipend to some families if they need it, to be able to support them, because it's tough out here. And sometimes any little bit that you get really does help, and it does stretch out. And for me, it reduces the stress and anxiety of our families to have that support.
Okay. And I know for this new initiative, the focus is more so on breastfeeding. Is that correct?
Yes, it is.
Okay. So would you advise families to access these services once she begins breastfeeding, or how early on should she begin accessing your services?
Oh, well, as soon as you're pregnant, we should have a conversation. That's just how I look at it, right? Mm-hmm. But the goal is through the program to have moms flow into it sooner than later. So what I don't want to happen is that women and birthing people, pregnant moms, I don't want us to be reactive when it comes to breastfeeding.
I think you're going on.
Okay. Camera. Okay. Can you see me now?
Yes, I can see you. I can hear you. I know you're saying you don't want us to be reactive, which I agree. I'm a big advocate of being proactive in all that we do to make sure we capture our families early on. So go ahead.
Absolutely. So the sooner you know that you want to breastfeed, come on and get into the program, right? But ideally, my goal is to see if we can start giving support as early as even like 28 weeks, right? Okay. Which is when if you're using a lot of the baby apps, they'll be like, oh, that's when you should reach out for a doula. But I sometimes get folks booking months out. And unfortunately, that's not always fair to them because they can't book if I'm booked out. So as soon as you know you're expecting, come talk to us, come check us out. If you know you even have a goal to breastfeed, come and be immersed in the information so that you're not being reactive, so that you're not trying to learn how to breastfeed after you've already had your baby, So that's really the goal.
Okay. And I know you shared a little bit earlier that this is very community focused, patient focused, client focused. But is there a referral process if like providers see that as soon as the mom comes in or later on in her pregnancy that she can benefit from the program?
Mm-hmm. Definitely. Just reach out to Metro Mommy Agency. I have a form on my page. And in the form, if you check off breastfeeding, then I will receive that form and I will know that you want to be flowing into any type of lactation or breastfeeding support. So that's pretty much the process at the moment. I'm sure we'll have a website really soon. But I just would recommend folks to reach out to Metro Mommy Agency.
Okay. And I don't know if we ever even said the name of the program, MOCA, correct?
Okay, yes. Let me tell you. Okay, what's the program name, right? Okay, so MOCA, we came up with MOCA, and Whitney kind of thought hard about this. And I thought about it as well in terms of what do these moms need access to? And the facts are, I could say, MOCA and put breastfeeding at the end, but they may need more access than that. To other types of services. So MOCA stands for Mothers of Color Having Access. Okay. And we are ready as leaders to kind of like support them in any way that they might need. So I really would love for folks to know if they are missing a community of Black mamas who know what this is about. Between the two of us, we have breastfed 9 children successfully, well over a year long each time. So if you're looking for that sense of community and support, then we're here for you. Okay.
Right. Awesome. So, and what are you trying to give mothers access to? Like, what are your other services?
Absolutely. Yes. So aside from doula services, we also, between the both of us too, we do a lot of postpartum doula support. So that support though, does come at a fee. And what that means is that we would be able to come into your home, help you with the breastfeeding on site in person. We'll be able to help you with navigating having a baby, how to change the baby, how to take care of the baby. But more than anything, postpartum doulas, what we do is we try to make sure mom is mothered too, that she's nurtured, that she's eating well, hydrating, right? Because if you want to breastfeed, it takes energy, it takes time, it takes effort. And if you don't take good care of yourself, if you don't have self-care going on or someone to look out for you in that way, then sometimes it could be a little bit of a struggle. So postpartum doula support would look like 4 hours minimum of a visit or more. Some people, book 8 hours, 10 hours. And what's happening is during the visit is we are allowing you to sleep. We're allowing you to rest. We're taking care of the diaper changes. We're bringing baby to you. We're addressing the latch. We're letting dad sleep. We're doing a lot. We're taking care of what's going on at home, etc. I also have different companies that I outsource to for for massage therapy, for mental health therapy as well, from actual professionals. They're all women of color. Like, so blessed to have them. They're amazing. I also have folks who do herbal baths if you need that, because postnatally it's a lot to recover from, and that's just one way to kind of nurture and love yourself as well. So the list goes on and on and on. I could be here all day, but we're here for you.
Awesome. Beautiful. And I know you have a menu of services not only on your Metro Mommy Agency website, but also on your Linktree, where and it's just Linktree, link.tre or however we go / Metro Mommy Agency.
Pretty much. Yep. Whatever the Linktree is.
Yeah. I don't know why I tried to do that.
But you could just go to the IG.
It's not,
Uh-oh. Uh-oh. I think I'm losing you.
I'm sorry. So let's talk a little bit more about Rose. So what is Rose?
Okay, so Rose is Reaching Our Sisters Everywhere, and it is a organization that strives to reduce disparities all around the country. So they are all about mobilizing folks who want to get into this work. Like myself, you don't have to be a mother. You can just be someone who's very passionate about helping families, and you can become, like I mentioned before, a community transformer. You can partner with them, you can volunteer with them, you can fundraise for them, and they have a branch of it that is also called ROBE, ROBE, which is Reaching Our Brothers Everywhere, and that is led by Wesley Bugg. And pretty much they try to mobilize fathers, to get involved in this work as well.
Beautiful. And okay. And thank you for sharing all of that. I'm excited about the services that you're already offering, as well as the services to come. How soon can families start accessing the MOCA services?
Oh.
Like, has families already started accessing MOCA, or
So
when
this
would be like the
upcoming
official kickoff?
Yeah, so technically, I had already been doing Breastfeeding While Black on Sunday evenings. And so we're going to continue on with that on Zoom. So if you are a breastfeeding mama or a breastfeeding family, you're more than welcome to come in. I kind of call it my office hour. It's a complete free office hour. We troubleshoot. You can ask questions. I will provide answers. And if I don't have the answers, I'll point you in the right direction. And that is going to happen on Zoom at 8:30 p.m. every last Sunday of the month. I do that. And then pretty soon, once I have the schedule and the flyer all together, I will be posting that as well. And there'll be more dates. So we tried really hard to think about what's missing when it comes to services. And I think what's missing is a lot of the services that folks want to access. Sometimes they're during 9 to 5. So you'll see a lot of our support is happening outside of those hours. So if you need support in the evening times, that's when we're kind of scheduling our classes and, any kind of support groups. So after work, come on through. We can meet you in person at the Southern Birth Justice Network, which is, 7 minutes away from me in North Miami Beach. Or you can jump into any of our virtual or live sessions that we're having as well. Okay, so everything should be on my IG at iCanDoula, and you can check out the link tree there for the Breastfeeding While Black support group there.
Considering breastfeeding or supporting breastfeeding families?
I'm sorry, do you mind repeating that? And I think you
I
cut
don't
out
know if
a
I went
little.
out. Okay. So I was asking, if nothing else, what would you like to share before we close out? What would you like to share with families who are viewing the live now or might access this live later, who are either breastfeeding families considering breastfeeding, or are advocates or professionals supporting these moms and babies and families?
Oh, definitely. I definitely would recommend, please reach out to me. I'm always all about networking and connecting and building, collaborative kind of connections throughout the community, because without that, it's really hard for families to move forward and get the support that they need, but also to hear over and over the messaging behind why it is they should be breastfeeding. And if we have more folks in our community who can do that, I feel like that's really going to help create the change that we need to see. And I also would recommend, since we are moving into this holiday, Thanksgiving, I would just definitely encourage you to use that time to continue to breastfeed your baby. If you are breastfeeding, don't shy away. This is a time where family and friends are around you. You can be an advocate. You could be a model. You could show them, hey, this is how it's done. This is why I'm doing it. And so I just want to encourage you to don't be shy about that. If you want to cover up, go ahead and cover up. If you don't want to, that's fine too. But definitely don't use the holiday season to say, hey, I'm not going to do this. Do it proudly. Okay. So I want to encourage you with that.
Maybe you want to join in on the festivities too.
And don't, it's a family fair. Breastfeeding babies are welcome on Thanksgiving. Okay. They're welcome.
Beautiful. Thank you again, Esther, for joining us, for sharing so much amazing, insightful information about the services that you're offering with Metro Mommy Agency, Southern Birth Justice, and Rose. Hope to have you on again soon, hopefully to talk a little bit more about some advocacy. And until next time, I hope everyone has a happy Thanksgiving. We'll tune back in next Tuesday for another Facebook Live series. Again, every fourth Tuesday are the breastfeeding masterclasses at 3:00. And until then, enjoy your day.
Thank you. Bye.